Hi, I'm Dr. Aaron Filler. Welcome to Spine and Nerve Health. Today's podcast deals with the problem of pudendal neuralgia. Pain and numbness affecting the private areas between the legs are often embarrassing for patients to even bring up with their doctors. No one has trouble telling about a sore back or the wrist and hand pain of carpal tunnel syndrome, but nerve symptoms affecting the urogenital areas and other structures between the legs are often difficult to talk about. Words can help with this, so in this podcast we will use the medical word perineum. This refers to any genital or rectal area as well as the entire area between the tailbone or coccyx in back and the pubic area of the lowest abdomen in front. The common factor in many problems affecting these areas is a nerve called the pudendal nerve. Just like entrapments of the median nerve in the wrist that causes carpal tunnel syndrome, or the sciatica that comes from a pinched nerve in the spine, the pudendal nerve can be pinched, and when that happens, the symptoms occur in the perineum, the urogenital area. There are many different medical causes for lower abdominal pain, sexual dysfunction, excess arousal, erectile dysfunction, or ED as it's often called, frequent urination, and sitting pain. And you should see your regular doctor or specialist gynecologist or urologist to find out if there is a common or routine problem that they can find and fix. However, if you've seen several good doctors and they all say they can't find anything wrong with any internal organs, it may be time to consider whether a pinched pudendal nerve is the actual culprit. Unfortunately, very few doctors know very much about pudendal nerve problems. Gynecologists and urologists tend to be trained in treating ovaries, the prostate, the uterus, the bladder, anything but the nerves themselves. On the other hand, neurologists, orthopedists, and neurosurgeons who diagnose nerve problems in other parts of the body often have little interest or experience dealing with nerve entrapments in the low pelvis. The good news is that the last 2 or 3 years have seen tremendous progress in diagnosis and treatments for these regions. Among the most important advances are 2 new, very striking areas of advanced technology. The first is a new kind of specialized MRI, or magnetic resonance imaging test, that actually shows the nerves. This is called MR neurography, or MRN. MR neurography is a technology that I invented and which has now been used to diagnose and guide treatments for tens of thousands of patients. MR neurography can actually locate and show the pudendal nerve entrapment. This is very important for many patients. Up to the time of their MR neurography test, many pudendal patients have had to try to convince disbelieving doctors and family members that they have a genital area pain or numbness at all. Often, these severe nerve problems are passed off as just psychological or personality issues. However, once the problem is actually seen on an image, physicians and families and insurance companies can understand that there is a real, identifiable medical problem. More importantly, once it can be seen, it is much more likely that it can be fixed. I'm one of the world's leading specialists in nerve and spine disorders. I've led the way in solving the problem, and I'd like nothing more than to have an opportunity to help you to find a definite diagnosis and to get excellent relief. Not only did I develop MR neurography and discover how to apply it to see pudendal nerve entrapments, but I also developed advanced open MR guided injection techniques to prove the diagnosis and offer non-surgical treatments. Most importantly, for those patients who have a proven pudendal entrapment syndrome, I've been the first surgeon in the world to develop safe, minimal access surgeries that reliably cure pudendal entrapments, returning patients to normal, pain-free lives more than 90% of the time. The key to the treatment success is my discovery that the pudendal nerve can be entrapped at several different locations. By identifying which type of entrapment affects a given patient, I've been able to design and tailor a variety of different treatment approaches so that each patient gets the individualized action needed to achieve a cure. My research has revealed that the pudendal nerve can be entrapped at the level of the piriformis muscle in the sciatic notch in the upper pelvis. It can also be entrapped at the ischial spine in the mid-pelvis or at the level of the obturator internus muscle in Alcott canal in the low pelvis. Some patients have entrapments near the very end of the nerve, and these can also be identified and treated. So, if you think you may have a pudendal entrapment syndrome, you should contact your doctor for a referral for an MR neurography diagnostic imaging study through the Neurography Institute. You should also consider traveling to Santa Monica, California for an open MR guided injection to prove and possibly treat the problem. Finally, if you are considering surgery for a pudendal entrapment, you'll find that no other surgeon in the world comes close to the very high success rates and rapid recoveries offered here. The injections are done at the Institute for Nerve Medicine in Santa Monica. I do the operations, usually at Cedars-Sinai Medical Center or UCLA. You may have spent a long and difficult period of time trying to understand what has been causing your symptoms. At the Institute for Nerve Medicine, we are truly looking forward to meeting you and getting your problem solved once and for all.